Hey everyone, it's Derek here again. Today is day 9 after my double jaw surgery for my underbite, and today's been a good day so far. I'll just kind of briefly go over how I'm feeling and my first follow-up appointment with my surgeon. So, yesterday, day 8, I saw my surgeon for the first time after the jaw surgery. Uh, and so basically I just went in and had an x-ray done first thing, and then, yeah, he said everything looked really good. He just kind of looked in at the incisions and everything, and, he said everything was really clean, and that sometimes people go in and it's just full of food, and so he was really impressed with how clean everything was. And when you go through it, you just gotta be diligent and just be rinsing, every 2 hours. Even like through the night I was doing that, and I think that really helped, because if you just have food stuck in there, not only is it gonna taste gross, but you're at risk for an infection too. So, and also brushing, the outsides, because it gets really gross looking. So he was happy with that. He actually took off the bands, and he said he wasn't even going to do that when I was in the hospital. He said he wouldn't even do that, but he took them off, so I brushed inside my mouth and my tongue and everything, and that was awesome. I found out though that I have absolutely no feeling on my top palate and my teeth and everything. My hard palate on the top. So I thought that I did have feeling, but it was actually my brain was tricking me into thinking that, because my tongue can feel the roof of my mouth, and somehow I felt like I had feeling, but I couldn't feel anything when I was brushing. So I guess in the surgery he ended up clipping a major blood vessel to the palate. I guess maybe for risk of bleeding. He didn't actually say why, I didn't ask, but he had to clip a blood vessel to the palate, and that's why it's so numb. So I'm not sure if he hadn't done that, if I would have feelings still. I don't know. But he said that the feeling should come back, but it could take a long time. So I don't know. He couldn't give me a time frame even. So hopefully it comes back, but if it doesn't, it doesn't. And I'll just have to really be careful that I'm, checking the temperature of my foods before I eat, right? So anyway, I brushed my teeth, and then I was opening and closing my mouth, and it was weird to open my mouth for the first time. I didn't get lightheaded or anything, and it wasn't really painful. It was just kind of tight, and the muscles haven't been used for a while, so it was really cool though. And to see myself in the mirror without the bands and opening my mouth, and honestly, it looked like my mouth was this big, and my teeth are they're not, some people have square teeth. Mine aren't. The front ones are, but I find my teeth are kind of like pointier, so I just felt like it looked like I had a big mouth full of razor sharp teeth, and it was really weird, and I kind of was like, ugh, I didn't really like it. But I think it's just because I'm just not used to it yet, and I think I will be happy with everything, but it just looked really weird at first. So I was opening and closing my mouth a little bit, and I could actually open my mouth bigger than I expected. Definitely could fit one finger in. But yeah, it wasn't as hard to open as I thought it would be, but still weird. So I was opening and closing. He left the room for a bit so I could brush, and then I noticed that, because I had a frostbite before, so I noticed that though when I was opening and closing, my frostbite kind of was back. Like the midline was off on the bottom, it was over in the middle there. So I just mentioned it to him, and so when he put the elastics back on, then you can see probably. I don't know how close I'm getting, but the elastic goes at an angle. And that's basically to pull my jaw over so I keep that midline. And the midline is perfect right now, so anyway, that might happen. I took a copy of the X-ray home with me, and I don't have it next to me now, but it was really cool to see. And there's 4 plates up top, 2 on each side, and then I had the 2 here. And it's really cool to see. It's crazy. It just blows my mind. So so I'll go back in a week to see him again. So other than that, things are going well. Yesterday I went for probably like a 45-minute walk total, and I felt a little weak, but honestly not that bad. Like, obviously I couldn't run or anything, and I don't want to. I'm not going to do that, but I felt a little weak, but I did, and I was so sweaty. Just after that little walk, I was drenched in sweat, so I don't know, that was interesting. Swelling, I think it's coming down quite nicely, and I think my left side still is a little more swollen, but it is slowly coming down, and I think I look pretty good. And he said that I looked really good, so I went and picked up from a natural foods and like a vitamin store this homeopathic Trameal, and it has arnica and some other things, but I mean, it's homeopathic, so there's really no scientific basis for this, but it's for swelling where there's been trauma, and so I just been putting like maybe bigger than a pea size on each side and rubbing it in. And I know it's probably not related to this, but yesterday after the surgeons, all of a sudden I looked in the mirror and it's like my swelling went way down, like more than this, and like it went down, and that was really weird. So I don't know whether it was just the combination of walking more that day and getting out and about, or whether it was this stuff, which I don't know if it was, but yeah, it like all of a sudden went down and then it came back up again later in the night. So I think it will fluctuate day to day for a long time, but other things, last night, I think because he changed the elastics and there's more tension, I had the worst headache I think I've ever had, and I never get headaches, so normally, so it was really bad, and the pressure in my sinuses here, it's still kind of bad, but it hurts so bad, so that was rough. But I think it was because I didn't stay on top of my pain medications like I had been doing all this whole last week, so I think I kind of left it a bit long, and that's why it got really bad. But he said that there's just so much clots still and like gunk all in my sinuses, and it's going to take a long time to clear out, so that's why there's so much pressure. Yeah, energy's good right now. My mouth feels really tight, like almost more than before. I don't know whether it's because I'm getting scar tissue and it's healing, but it feels really tight. It's kind of weird, but that'll come. My lip is really tingly still, and I'm quite like, I can't feel that, but I do get the itchiness still all here. But yeah, this is still pretty much numb. I have all the feeling here still, basically all the feeling on my nose. I think my nose got a bit better, but still a little off. But yeah. Anyway, despite yesterday having all that pain at the nighttime, I actually slept the best I've slept since the surgery. I got up once at 1. I went to bed at around 10 o'clock. I got up at 1 in the morning and just had some pain medication. I think I had Tylenol. And then I went back to bed, and I didn't wake up till 4 again, which is awesome. Took a little bit more pain medication. I think I took ibuprofen and a little codeine, just like less than what he prescribed, just a little to take the edge off. And then I didn't wake up. Oh, I went to bed again maybe 5:30ish, and then I didn't wake up till 8:30. So that honestly has been the best sleep that I've had since everything. So I'm really happy about that, and probably just getting up, going for a walk, and being out more of the apartment, that probably helped with my sleep. So with these new elastics, I can kind of open my mouth, but I'm reluctant to do that because I don't want the elastics to snap, and because